Narrowband imaging versus high-definition white light for optical diagnosis of small colorectal polyps, a randomized multicenter trial. Introduction. The implementation of screening programs has led to increasing numbers of colonoscopies over the past years. This approach naturally implies a greater number of detected polyps. The removal of these polyps and evaluation by a pathologist in order to make a diagnosis is time-consuming and expensive. An optical-based prediction of polyp histology and the differentiation between neoplastic and non-neoplastic lesions would enable endoscopists to more quickly inform patients of their examination results. Furthermore, a resect and discard strategy has the potential to reduce costs if polyps are not routinely sent for pathological assessment after resection. Virtual chromoendoscopy has been shown to facilitate optical classification of colorectal polyps. Gastroenterological societies in the United States and European associations support the virtual chromoendoscopy-based optical diagnosis approach but demand high-quality standards. Recent data have shown that quality thresholds are not yet reached in the daily use of optical diagnosis. The narrowband imaging (NBI) International Colorectal Endoscopic (NICE) classification was validated for an NBI-based differentiation between adenomatous and non-adenomatous polyps. However, until now, no data have been published to determine whether a preferable video modality exists for optical polyp assessment. Klare et al. Conducted the current prospective randomized multicenter study in order to compare the performance of optical diagnoses using either a new NBI device or high-definition white light, HDWL. Background and study aims. The aim of the study was to compare the latest narrowband imaging (NBI) device with high-definition white light (HDWL) endoscopy for accuracy of real-time optical diagnosis of small colorectal polyps. Patients and methods. The authors conducted a randomized prospective multicenter trial at 3 study sites in Germany. In the NBI arm, endoscopists used NBI for the prediction of polyp pathology on the basis of the NBI International Colorectal Endoscopic Classification. In the HDWL arm, NBI was not used for optical classification of polyp histology. The primary outcome was accuracy of optical diagnoses, neoplastic versus non-neoplastic, in small polyps measuring less than 10 millimeters. Secondary endpoints included sensitivity and negative predictive value, NPV. Results. A total of 380 patients were randomized 1-to-1 to either the NBI or HDWL arms. A total of 421 polyps measuring less than 10 millimeters were detected, 55.8% neoplastic, 44.2% non-neoplastic. Accuracy, sensitivity, and NPV were 73.7%, 82.4%, and 75.5% respectively in the NBI arm, and 79.2%, 79.8%, and 73.4% respectively in the HDWL arm. More polyps were assessed with high confidence in the HDWL arm, 82.6%, than in the NBI arm, 73.7%. The NPV of the prediction of neoplastic histology in diminutive polyps, less than or equal to 5 millimeters, rated with high confidence, was 90.3% in the NBI arm. Klare et al. Detected significant differences between the participating study sites in the performance data of predictions. Conclusion. The levels of accuracy for real-time prediction of polyp histology, less than 10 millimeters, did not differ between NBI and HDWL for optical diagnosis. Variation in the performance of optical diagnosis was apparent between study centers.